I'd like to introduce Karen Sal, who is the Bureau Chief at Arizona Department of Health Services, and and it is nutrition and physical activity. They changed their name, so I'm a little unfamiliar, and so I will turn it over to you, Karen.
Thank you. Emily, can you put up what I'm here today to talk to you about, and you will hear more about later on today in our SNAP Ed program and how you can become a part of it, is success stories and what we can do together as a community. Many of you in this room and I have worked through the creation of CSFB and the expansion of the WIC program here in Arizona. And WIC and the changes of WIC and farmers market linkage is a success story, and I'd like to bring you up to date on what's happened this past year. We have a new food package, and WIC stands for the Special Supplemental Nutrition Program for Women, Infants, and Children. We're 36 years old, and we got our first facelift this past year. WIC is different from other assistance programs in that we concentrate on our message of nutrition and breastfeeding, and our food package is secondary to the services that we use and offer our clients in order to enable them to make healthy choices. In the past, our clients didn't have access to fresh fruits and vegetables, but we have a new coupon, and we're going to talk a little bit about that. WIC was founded, as I said, 36 years ago, but in 2010, because of an increase in funding, we're now able to serve 9.1 million Americans. Here in Arizona, our caseload has risen significantly, just like DHS. And we have 630 vendors. So we purchase our foods through the grocery stores, but we're especially excited in that this year we've authorized 71 farmers to be able to be WIC providers of fresh fruits and vegetables. The next slide. Emily, can I go to the next slide? When we look at WIC and where WIC is, many of you work with us. We have 21 agencies. We have our WIC providers, our community health centers, 14 counties, and 1 tribe and 1 faith-based organization. We have 120 clinics. We have 600 people in the field. And we serve in a variety of different locations because we try to be where our clients are. And today it was really exciting to hear that Clinical Adelante is aligning in Avondale with a literacy program, and we will soon be increasing our focus there. While WIC serves nationally 9.1 million, here in Arizona, in the month of March, we served 182,267 women, infants, and children. And you can read the numbers for infants and children, but we could serve more. And we feel, as was described by Neil, that there is a group of people out in the community that are new to the challenges of our economy and really don't know about WIC. And that's why I came today, because we really need your help. In your packets, there's a white sheet of paper about what we can do to help each other, because the first step is using the existing resources, is getting women, infants, and children to WIC. How can WIC help? Well, when they come to WIC, we offer them a lot of resources. We help them get to prenatal care. We provide breastfeeding services both in hospitals and in our clinics, because breastfeeding is the first defense against childhood obesity. We have proven, and we are successful in improving birth outcomes and reducing infant mortality. If they participate in WIC, the babies are bigger, the moms are healthier, and we all benefit from a reduced cost of health care. For every dollar that's spent in WIC services, there is a savings. Who's eligible for WIC? There's a misunderstanding by a lot of people about the eligibility criteria, and as you can read, we go up to 185% of poverty. So if people are eligible for school lunch, they're eligible for WIC. We only require that they live in Arizona. They must be a woman, infant, and child. And we determine their risk criteria, so there's no cost for the screening that goes on in WIC. We've been shown to improve disease outcomes. Our immunization rates are higher than the general public because when they're in WIC and we're co-located with other services, we can get them to those services. I'd like to talk a few minutes about our new WIC food package and make you aware of what legislative change can do. Last year, the WIC food package changed so that we now offer all of the foods that you see on the screen. We're particularly excited about the fact that we offer fresh fruits and vegetables, whole grains for the first time, and that for children we are now providing fruits and vegetables in a different form for infants in pureed form. I'd like to outline the pregnant woman's package so that you can see how we can help if you know someone who's pregnant and doesn't have enough to eat. They get $10 a month for fresh fruits and vegetables. They get milk, they get cheese, they get eggs. For infants, they get 7 cans of infant formula, which is enough when the child is small to meet most of their needs. And as they grow, we introduce fruit, cereal and pureed fruits and vegetables at 6 months. For a child that's a year old, we now offer them $6 a month in fresh fruits and vegetables, in addition to 2 loaves of 16-ounce bread, which make up their 2 pounds, or they can choose brown rice. But it introduces the family to whole grains, and it provides real key nutrients and starts a family in exploring new foods. The benefits of the WIC food package are outlined on the screen for you in that it is a nutritious package. It provides B vitamins. We accommodate to dietary needs because in many cases, and right now, we provide special formulas and medical formulas to more than 3,000 children a month that would not have those medical formulas. We have and do emphasize breastfeeding, and we are seeing a real increase in the initiation and duration of breastfeeding. And children are getting more fiber in their diet and access to whole grains, and hopefully that will keep and carry forward into the changes of the school lunch. We know that the baby foods that we are now providing to families and the new education is going to improve feeding development in children, and when children eat better and know more, the moms know more, and we introduce that parent and child relationship and establish boundaries, that we can have an impact, and our research shows that we can have an impact on childhood obesity. I'd like to talk a few minutes about the Farmers Market program. Those of you that are aligned with St. Mary's as well as Community Food Bank are familiar with our Farmers Market program. Right now, we receive additional funding from USDA to provide farmers market coupons. It's targeted to 6,496 women and 4,833 seniors, and we're especially proud of our senior services. We combine these services with both CSFP and the WIC program, and our goal is to improve nutrition, support local farmers, and keep the food dollars in Arizona. Who's eligible for Farmers Market? Farmers Market is eligible for every woman and child, and I would like to serve every woman